More than 100,000 people are diagnosed every year with cancer, and that will result in the biggest challenge they will ever face in their lives. My name is Ryk van Niekerk, I'm the editor of MoneyWeb, and welcome to this panel discussion about cancer. I've got three esteemed guests. Lucy Bologna, she is from Cancer. Luciano Bernardi, he's a wealth manager at Efficient Wealth, and he's also participating in the 2023 Absa Cape Epic, and he will be riding for Cancer. And Dr. Nolethandu Nematswareni, thank you so much for your time. She is from Discovery Health. Luciano, I want to begin with you. You have taken the big decision to ride the Cape Epic, and you are riding for Cancer. Why Cancer?
So, Ryk, I think cancer is, it's such a real disease, and it sort of hits home. In our team, for instance, we've dealt with cancer firsthand on numerous occasions, and we saw the devastating impact thereof. So I thought, myself and my partner, when the opportunity arose for us to represent cancer specifically at the next Epic, we thought it will be a great idea for us to leverage our 15 hours a week that we spend on the bikes, whilst creating this awareness for the cause and cancer specifically. The work that they're doing, we'd be using the time to really leverage time and allocate as much as possible funds to assist in a fantastic cause.
Now, it is a fantastic cause, and I think you cannot, promote or make awareness for cancer. It needs to happen as loudly as we can do it. But, obviously you're sitting on a bike training for 15 hours a week, which is significant. If you do the sums, it's a few hours a day. Tell us about the thought process going through there and training, and how much do you think of this cancer cause while you're sitting on your bike?
Now, look, obviously there's a lot to think about whilst sitting on your bike. Obviously you try to expose the cause as much as possible. So we've done a lot of work with the design of our riding shirts, as an example, to represent the cause at all times, in order just to create a presence. In my conversations with fellow cyclists and the like, we've come to realize that even though everybody knows about cancer, not everybody necessarily understands the work that they do. And I think that's really where we're focusing on. So in bunch riding, that creates an opportunity whilst you're grinding through the pain. You have the opportunity to then pitch the actual cause and maybe just give a bit more perspective of what it is that cancer actually does and the role that they play.
Lucy, cancer is a very, very important institution in South Africa, but I was surprised to hear that more than 100,000 people are diagnosed with cancer every year. It's a significant number. Which cancers are the most prevalent?
Well, we've got in women definitely breast and cervical, and in fact there's actually a lot of underreporting. There are a lot of people out there, they're not even reporting because they don't have access to care or access to services. So we use the National Cancer Registry statistics because it is pathology based, and we've seen it, with women, breast, cervical, and creep, and then we've got colorectal. Colorectal is actually in the top 5 with men as well. With men it's prostate, lung. And amongst the younger men you've got testicular, which isn't very prevalent, but as much as prostate. So it's very much important that men are aware of prostate and that women are aware of the breast and the cervical cancer risk. What
can you do to lower the risk?
Well, very similar to what Discovery does. We have a very similar health message. It's about leading a balanced lifestyle. So what Luciano is doing is extreme physical movement, but it's about being active, getting physical, eating the right foods, whole foods, plant-based, lowering the amount of red meat that you eat. It doesn't mean you must take it away. It's about having a balanced place every day, not eating processed foods, having safe, clean drink water to drink. And very important is actually screening. It's like if you drive a car, if you own a car, you want to make sure that your car is getting maintained, it's been looked after, and you should be doing the same with your body, making sure that you're doing regular screening and checks. So that's what the Cancer Association of South Africa does. We encourage people to do screening. We encourage women to do self-breast exams. We encourage them to go for a mammogram. We encourage the men to make sure they do screening for prostate cancer. So those are the a very similar message. Those are the simple things that you can do to lower your cancer risk. There is, of course, genetics that do play a small part, but there's action that we can all take.
Dr. Noluthando, screening. I believe that word has been said a few times today, and that definitely lowers your risk of getting cancer because you can catch it quite early. How does it work? What is the process of getting screened?
So thank you so much for that question, and I thank Lucy for just highlighting the importance of screening, but also preventative measures like a healthy lifestyle, because like she said, only a small percentage of cancers, about 5 to 10%, are hereditary. So it means the rest are preventable. So if we think about screening, screening is really a process of picking up cancers when you are not symptomatic. So it's people who are otherwise healthy presenting themselves so that we can pick up cancer in its earliest stages. And the importance of that is that the earlier you diagnose it, the better the outcomes. So the outcomes in terms of survival, but also financial, outcomes. If you think about treatment of cancer, the earlier it is, when you pick it up, the quicker you can deal with it, and it is cheaper to actually manage. So I think we cannot overemphasize the importance of screening. And usually, so if we think about women, for example, when we think about breast cancer, some of the screening methods that are there, yes, there is the self-examination, which we encourage women to do, but the most important thing is for women to actually know their bodies. Because if you do not know how your breasts look, how are you going to know when they are not looking fine? And then the next best thing is then to present yourself to healthcare professionals who can examine your breasts. But the most important part of screening for breast cancer, for example, is going for x-rays like your mammogram. And for some women, you combine it with ultrasound. And for some women who are at higher risk, even MRIs can be used to screen those women. And the frequency will depend according to your risk. So more frequently, so we say at least annually if you are at high risk, meaning that you've got some genetic predisposition to breast cancer, and you actually start earlier on, because we know that the cancer risk increases with age. So we usually recommend that women over the ages of 40 start screening, but if you've got a genetic risk to breast cancer, you must actually start earlier. And then the other important piece...
And men?
And men, so men, when we look at men, so the cancers that we recommend screening for will be colorectal cancer, because colorectal cancer is actually common across, both genders, male and female. With colorectal, we recommend at least from the ages of 45 that you go. Usually what we recommend is a stool-based, meaning that you do collect stool. It is tested for, tiny drops of blood that are not visible with the naked eye, but they may be an indicator that there is something going on inside. So those, stool-based tests are done every 2 years. But for some men and women who are at high risk for colorectal cancer, they need to be doing much more advanced screenings, like using a colonoscopy, which is a camera that goes inside your bowel to see if you do have any signs of cancer. And then there's prostate. So I think it's an important one to speak about, because if we look at guidelines and recommendations, while there is no recommendation that all men go for prostate screening, we also do encourage men, especially when they get older, to do, when they go for their usual general, routine exams, for the doctors to just check their prostate, to look at the size, look at the consistency, to see if they are developing any signs of prostate. The reason why there's been some controversy around, recommending population-wide screening for prostate is that there are some cancers that are slow growing, may not really require any intervention, and therefore you don't want everybody to go there and everybody then to pick up something and there is an intervention, because you want to balance the benefits with the harms of actually doing the screening itself. I think I've said so much.
People who are higher risk should be screening more often.
Yes.
How do you know if you're high risk?
So there are specific conditions that put you at high risk. So there are genetic predispositions, so where based on your family history that there's a strong family history of cancer, not necessarily just breast, for cancers. For those people where there's a very strong family history, actually at Discovery we have developed a family history tool which actually gives members a sense of their risk based on family history. The other important risk factor is some underlying conditions. So if you think about colorectal, for example, people who have got inflammatory bowel disease, so they've got Crohn's disease, they've got ulcerative colitis, or they've got other rare genetic disorders, Peutz-Jeghers, they've got polyps in their colon. We know those are people who are most likely to develop cancer, and therefore we want them to screen more frequently. And also with the tools like colonoscopy that are much more sensitive in picking up cancer. With women, there are some genetic, indicators like BRCA test, which is a genetic test that, if you do have that and you have a strong family history, we recommend that you screen much more frequently. And we also, encourage people to actually go for those genetic tests, because once you know that you have got that gene mutation, then we know that then you need to actually start doing things differently, which includes frequent screening.
Just last question, where can a person go for a screening?
So I'm going to now focus mainly on, when I think about private sector patients. So screenings, when we're talking about, because remember we've just spoken about all cancers, which is quite broad. So I think the most important person as a starting point will be your healthcare professional, because they can direct you in terms of where you need to screen. Because like I said, there are various cancers that we screen for. If you're thinking about prostate, they can do it in the rooms and then recommend further testing. With breast, because it's mainly, X-rays, so radiology. So radiologists actually do the screenings. You don't need to be referred as a woman to go to a radiologist to do mammography. As long as you are within the age group that needs to be screened, you can walk into a radiology practice and they will screen you. And I think the important thing is that most medical aids, including Discovery, have got benefits that allow members to actually go and screen. But we are not seeing the screening rate that we expect to see, based on the fact that people have got access to these benefits.
Luciano, when last did you screen yourself or went to a screening?
I'm guilty, Rake. I'm guilty. I must definitely go through the process.
I must say I've got grey hair, but I'm not that old. But I'm in the firing line. I will most definitely make a plan to do that. But that is a very interesting point Dr. Nolo made, and that is that not enough people screen. Why is that? Is it just not being aware that you need to do it? Are people scared of maybe the invasiveness of screening? What are your experiences?
I think there's a number of reasons. I think when a person is diagnosed, first of all, they're scared. It's the fear of the unknown. How do I cope? Also lack of education, just not knowing enough. And I think one of the things, just as you said, not enough screening, we see a lot of people coming at a late stage. So the whole point is about screening is that the earlier you catch it, the earlier that you detect cancer, the better the treatment plan and the better the outcome. That's what we try to encourage. So, I think it's just a number of reasons. They sit and they fear and they think the worst, or they don't want to know, or they just, I'm going to avoid it because I don't want to know. And the more you know, the better. And you were mentioning earlier when we had a private chat where you said there was a history of cancer in your family. So as you mentioned, the minute that there's a family member with cancer, then your risk, I think, is also increased. So I know my mother had cancer, my aunt had cancer. So for me, with my medical aid, I'm actually at Discovery, I know that I can go more, once a year, where other women only have to go twice every second year. So, we deal with a lot of, with the private, we also deal with patients that don't have medical aid. So that's part of our role. We also offer screening. We do clinical breast exams. We don't do the mammogram because we know it needs to have a proper professional to read the x-rays. And then we also do the blood tests, for the men, the prostate specific, they call it the PSA test. And I think a lot of men there, and I mean, I'm talking to both of you and I know it's about, you can actually help educate your friends and others, is because men are afraid. They always think, I have to go for the digital rectal exam. But you have to basically you can just do the blood test. And if there's something wrong, then they will refer you to a health professional anyway and a doctor, and then you probably will do the exam anyway. But rather have that done and know that you've looked after yourself and you've now got a proper treatment plan in place.
Now, Luciano, how much did you learn today? Obviously, you're riding for cancer. But it seems like there's a lot of information that is not in the public domain, which actually should be, and that's where the awareness campaigns are so important. What did you learn today which you didn't know before?
No, I mean, there's obviously a lot of stigmas relating to cancer, and I think that's really what stood out. So just to put that in perspective, I think we'll focus our strategy and our marketing campaign, if you want to call it that, to really eliminate as much as possible of that, with the assistance of cancer and the detail that Dr. Nolo provided. So
yeah, I think it's a critical statistic that so many people get cancer, and in many ways many people think it's not going to happen to me. But Doctor, maybe you should put your hat on as being from Discovery, getting cancer can be very, very expensive. And I'm talking sometimes 7 figures to treat it properly. What should people do to ensure that they do have sufficient cover to pay those expensive medical bills should they contract cancer?
So what's important is that treatable cancer is actually a prescribed minimum benefit, meaning that all schemes need to be paying for cancer care. But just to go back to the importance of screening, the earlier you catch the cancer, the cheaper it is to manage. The more advanced it is, you almost triple the costs. And like you rightfully say, some of the treatments are over R1 million. And most people cannot afford to be on plan types that actually even fully cover those treatments. Even in scheme benefits, it's usually very difficult to get a full cover for most of those treatments, meaning that most of the people with advanced cancers who require those expensive treatments will have out-of-pocket expenses. We refer to this as financial toxicity related to cancer, where people are really selling their houses to get, at least to just get cancer care. So I think if we can really pass on an important message today is that early diagnosis is not only important for the survival benefits that you get. I mean, for some patients, you get cancer, you are treated, you actually are cancer-free, and you live a long and productive life. If people can think of it that way rather than as a death sentence, it's better, because once you get to advanced stages of cancer, it's a very difficult and painful journey, physically and also financially. So I think really the message is that the earlier the better, for many reasons that we've already mentioned.
Luciano, are we going to commit to be screened before the end of the year?
absolutely, Rick. I think, as you said, we have now reached the point where we're in the firing line. So it's I see it as our responsibility to contribute towards what we're standing for here.
Yeah, I will most definitely do so. I think it is critical, and yeah, I think the awareness should be, we should shout it from the top of buildings and from bicycles in your case. So, but good luck with the Cape Epic. May you enjoy it, with at least some of it, and yeah, good luck with your venture.
That's a relative statement, but thank you very much, Ryk.
Yeah. Dr. Nolathandu, Luciano, Lucy, thank you so much for your contributions today.
Thank you, Ryk. Thank you,
Thank
panel.
you.
Thank you.